couple of things that I need to be cautious with or really thoughtful about when I'm doing this kind of a wrap is I need to get the person to I can say the word, abduct their leg so that I can get way up in the groin area. Okay, I want to be up as high as I can go. Now, if you're working in an acute care hospital, which is generally where you're doing this kind of residual limb wrapping immediately after surgery, person usually doesn't have jeans on, right? And depending on the gender, it really doesn't matter what gender, you want to protect modesty, okay? So that's where you hand them a towel and you say, please arrange this in such a way that I'm not going to, embarrass you, that you've got all of your equipment out of the way. And but I am going to be, and then explain to them, and I usually show on myself, I'm going to be coming up here. Okay, we're going all the way up to here. And so they understand what they need to protect and what they don't need to protect, okay? And then I make sure on the model that I get all the way up. So if you're using jeans as your model, okay, then we'll say that this is skin and you're going all the way up as far as you possibly can, okay? So in real life, you are getting pretty close and personal with your patients, okay? So often I'll just say, would you mind just, just kind of scoop things off to the side, and just hold over that way so that I can do my thing. But, you're getting your hands in there. The potential for accidentally, brushing up against something that you don't really intend to is pretty high. So again, just start out with explaining why, explain the purpose. We really need to get up here because this is so important. We want to make sure that you can get into a prosthetic device, later on. We need to shrink this down. So, I'm sorry, I'll apologize ahead of time. I don't mean to. Usually when you set it up that way, people are fine with it, especially if you ask them to kind of help you out. If they're unable to help you out with kind of taking things to one side, then you can come in with a towel or sheet or something and then just kind of say, I'm just going to kind of move things over and tuck as much as you can or whatever so that you're not, not directly encountering what you don't want to encounter, okay? All right, so I've already got a bad thing here because look at that. Bad, 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 okay? So I'd have to go back. I don't know why, because it looked like it was fine, but I think I talked too long and moved things around. I don't know. So, and when I find out that I didn't do something the way I like it, then I usually go back and snug up the wrap again because I can't deal with long pieces of East wrap. Okay. I don't know, I'll try it this way this time. It doesn't really matter which corner you get first. Okay. But again, way in here. So you see where if this was a real patient, I'd be kind of in the way of what's going on now. I don't like that. And sometimes you can just pull or place the bandage so that it's better. It's not the best. I'm not going to be really happy with this, but we'll aim. We'll aim to please. Oh, and I don't want to start this way. Okay, so. All right. I forgot. There was a reason why I started the way I did, and we're going to be doing a hip spica to hold this on, and I want to go around the patient's hips in a way that makes sense. So let me try one more time. Sorry. And with a real patient, sometimes you need to do that kind of finagling so that you're not right in their business, right? Oh my gosh, and you're filming.